Welcome to this detailed video on the mechanism of diagnosis for the dobutamine stress test, a critical tool for assessing heart function in patients who cannot undergo traditional exercise stress testing. In this video, we'll explore how this test works and how it helps diagnose cardiovascular conditions, particularly by evaluating the presence of ischemia, heart valve function, and overall cardiac performance. Let's start with the administration of dobutamine. Dobutamine is a synthetic catecholamine that acts as a beta-adrenergic agonist, primarily stimulating the beta-1 receptors in the heart. This leads to an increase in heart rate and the force of contraction, effectively mimicking the physiological conditions of exercise by increasing the workload on the heart. As dobutamine increases the heart's rate and contractility, the demand for oxygen by the myocardium, or heart muscle, rises. In a healthy heart, the coronary arteries respond by dilating to supply more oxygen-rich blood to the myocardium. However, in patients with coronary artery disease, CAD, narrowed or blocked coronary arteries cannot deliver enough blood to meet this increased demand, leading to ischemia. Now, let's discuss echocardiographic imaging during the test. Baseline echocardiographic images are taken before administering dobutamine to assess the heart structure and function at rest. This includes evaluating wall motion, chamber size, and valve function. As dobutamine is infused and the heart rate increases, continuous echocardiographic monitoring allows clinicians to observe the heart's response to stress in real time, focusing on changes in wall motion and overall function. One of the key diagnostic mechanisms of the dobutamine stress test is the detection of ischemia through wall motion abnormalities. In the presence of ischemia, certain areas of the heart muscle may not contract normally under stress. This can manifest as hypokinesia, reduced movement, akinesia, lack of movement, or dyskinesia, abnormal movement, in the affected regions. By comparing echocardiographic images taken at rest and during peak stress, clinicians can identify these abnormalities, which suggests that those areas of the myocardium are not receiving sufficient blood flow. If these wall motion abnormalities appear during dobutamine infusion and resolve after the test when the heart rate decreases, this indicates reversible ischemia, a hallmark of CAD that might benefit from revascularization procedures. The test also assesses the heart's ejection fraction, EF, which is the percentage of blood ejected from the left ventricle with each heartbeat. An appropriate increase in EF during the test indicates good contractile reserve and cardiac function, while a failure to increase or a decrease in EF during stress may indicate impaired heart function or extensive ischemia. Additionally, the dobutamine stress test evaluates valve function under stress. For example, in conditions like aortic stenosis or mitral regurgitation, the test can reveal how these valves cope with increased cardiac output and pressure during stress, which may not be apparent at rest. As the test concludes, the dobutamine infusion is stopped and the heart is allowed to recover. Final echocardiographic images are taken to assess any changes that occur during the stress phase, and the patient's vital signs and ECG are monitored until they return to baseline levels. In summary, the dobutamine stress test diagnoses cardiovascular conditions by pharmacologically inducing a state of increased heart rate and contractility, simulating exercise. The heart's response is monitored using echocardiography to detect ischemia, assess overall cardiac function, and evaluate valve performance. The presence of ischemia is indicated by new or worsening wall motion abnormalities during the test, which helps in diagnosing coronary artery disease and other heart conditions. Thank you for watching. If you have concerns about your heart health or believe the dobutamine stress test might be appropriate for you, be sure to consult your healthcare provider.